part of this community with people who are searching for non-surgical, non-drug, non-addictive ways of managing back pain for bulging discs, herniated discs, spinal stenosis, and facet arthropathy. And we're going to talk about that today, so you can understand, if you are dealing with those things, what that means to you, perhaps where that pain is being generated from, and your non-surgical options that can be really successful and are successful for almost everybody. So welcome. If you're joining me live, please say hello in the comments. Would love to say hello to you. If you have questions, I'm here to answer them for you as well today to the best of my ability. And we'll get going. So just would love to say hi to anybody that's here. So what are we going to talk about today? Well, we're going to be talking about how to eliminate and heal your back pain naturally with over a 90% success rate from your home. I know this kind of sounds probably far out there, but I'm going to let you know I've been doing this stuff for 24 years, and you're going to see I had to heal my back. So, if you don't know much about me, I only share this with you. I just was on the cover of the 3 largest chiropractic magazines in the world since I started practice. I was also in 2019, 20, and 21 voted one of the top spinal decompression doctors in the entire United States. So I'm proud of those, only for the mere reason is that I want you to know that I'm really passionate about helping people, and I'm super passionate about spinal decompression and its amazing effects and ability to help you heal your spine and your spinal pain in your neck or your low back, and you can do it from home if you don't have access to go to a doctor. What else? I was also very fortunate to get to work with some amazing people like Ed McMahon and Regis Philbin and Jeff Foxworthy, Dr. Wayne Dyer, one of my favorite humans in the whole world, Sean Mullins, Suzanne Summers, the Indigo Girls Band, and a lot of other people as well. But I think maybe what makes it really real is that a few years ago, I messed up my back really bad. I know this picture is pretty gross, but that was actually a picture of my low back after I fell at the skateboard park when I was hanging out with my boys, trying to inspire them to go for something in their life. And, sometimes you got to fail. And sometimes failure lets us see the most important ways of learning of how not to do stuff. So it's not failure is a success, except this one hurt a lot, really bad. I was really scared. Hi, Stephanie. So great to have you here. Thanks for joining me. You're always such a blessing in my life. So I hope I bring the same joy to you too as well. So great to have you here. So this is real stuff. This took me months to get over this pain. I thought I was going to need surgery. I was very scared of what my future looked like, especially as being a dad, being the sole income provider for my family. So I want you to know I've walked in your shoes. If you're dealing with back pain, if you're dealing with this condition as we talked about, I've been there too. And that's why I show you this picture. So I'm not just a doctor who studies this stuff and it's never happened to them. It's happened to me. And it was not a good time in my life, but I learned a lot from it, right? So you learn through these things if you pay attention, and you learn what works, what doesn't work, and that's how I was able to create an amazing course. So take all that plus 24 years. So I'm right there with you. So that's my story. So let's talk a little bit about what causes back pain. Stephanie, you probably know all these answers by now. Well, there's 2 major components of the spine that cause back pain. Number 1 is the spinal disc, and number 2 is the facet joint. So let's go look at those for a minute here. So this whole unit that we're looking right here is called the intervertebral disc. It's made up of 2 parts. You have this inner jelly that is all in here, and you have these outer rings that you can see, and that's called the annulus fibrosus. So we want the annulus to be totally intact, so as you can see these rings that come around the front, how healthy they are and what they look like. They should look exactly like this back here, except they don't in this person. So you can see a tear to the annular fibers, which is known as a disc bulge. And then if this jelly squirts out of that to any extent, that's called a disc herniation. And usually those are going to cause back pain for most people. And they can cause back pain one of 2 ways, either a physical pressure on the nerve like you're seeing right here, where you have this jelly-like viscous material pressing on a nerve, and nerves don't like to be pressed on. And that can cause pain, or from what's called cytokine release. And here's a different view. It's kind of looking down onto the disc, where here we have this jelly like we talked about, the nucleus. This is gone all the way through because these gray fibers have torn, and come out, it's pressing on this person's spinal cord right here and also onto their major nerve branch right here. But the other thing it can do is not only does that have that physical pressure on those nerves, but you can also get these little yellow sensors called nociceptors. They're actually a pain sensor. And anytime that when there's tears to your disc, you release this oozing stuff called cytokines. And cytokines will irritate those yellow fibers and cause back pain. And you're going to see that a lot in a bulging disc. You'll see it in a herniated disc as well, but you're going to see a lot in a bulging disc because you don't have so much of this jelly squirting out, but you have these tears to the disc and it irritates those pain sensors a lot. So that's going to be how you're typically going to get pain from a disc issue. And the problem is that if you go to most of your pain management specialists, they don't have a lot to give you, to offer you in pain management besides an epidural or going to a surgical route. And I don't like either one of those, to be honest with you, because there's so much better ways of fixing this stuff and actually correcting it and fixing it versus patching it up. So let's look at the other cause of back pain, and that is called the facet joint. And this is the part of the spine where it sits in the back. And so I'm going to show you that right here. And so it's this part right here, and you'll watch where the bones glide with each other, and where they glide at right in here, that's called the facet joint. And so when we look at this picture, so you know what you're looking at right here, this is a facet joint. And what you're looking at is you're looking at one that has arthritis to it because it's not supposed to be bumpy like this. And when they get arthritis, and they usually get compacted a lot of times, especially when people sit a lot, it'll irritate these nerves that you see right here, these yellow fibers. And if you go to a pain management specialist to deal with this, they're usually going to do a medial nerve branch block. And they're going to try to numb this nerve, and they say, you know, hey, if we got you out of pain, then this is successful. But you got to realize if you don't do something to get this tissue right here to be healthier again, you're always going to be dealing with this pain constantly. So it's like patching a pothole up on a road versus repaving the road, okay? So those are going to be your two major causes of back pain. And the beautiful part is I'm going to teach you how to address and fix both of them at the same time from your home. So I'd like to give you a couple tips today. Number one is so you can start feeling better. Number one is please start holding your phone up. So when you're talking on your phone, and this is a picture of me, this is what you want to be doing. So you want to be looking straight ahead at your phone. And so when you're doing that in person, you know, you're going to take your phone. This is what most people do, down like this, right? And put your elbows on your chest and get your phone up like this. And you can scroll and text and email and talk and everything else like that. That you need to, but you're going to take all the pressure off of your neck by doing that versus this. Switch to this picture, you see a little bit better, is me holding my phone down, which is what you see most kids doing, and believe it or not, most adults that I see, right? And what that does is that puts a tremendous amount of squashing and compression onto your disc, and when that happens, you're going to continue degenerative disc disease, and you're going to probably be in a world of hurting after a little while. So I ask you, please hold your phone up like this. Start doing that, please. You're going to thank me, I promise you. Number two tip is understanding postures. And when you're looking at this chart right here, it's called an intradiscal pressure. This is more for the low back. What we are talking about, how much compression is taking place in your spine. Remember, we don't want compression into the spine. The more compression, the more disease. All right? So when you lay on your back and you go to bed, you get about 25 kilograms of pressure in your low back. It's not that much. You flip to your side, it's 75. When you go to stand, now we're up to 100 kilograms of pressure into your spine. So it's a different situation. The main thing I want you to look at this right here is I want you to look at this guy. 185 kilograms of pressure into his low back. It's almost twice as much as standing. And this is your typical posture that people are going to go into when they're sitting at their desk, looking at their keyboard, and looking at their screen and being off of the back of their chair, okay, leaning forward. So you don't want to do that. You're almost doubling the amount of compression. And that's where you're seeing a lot of people since COVID start having a lot of pain in their spines. So please, you want to start sitting back against your chair, more like this gentleman is. So because you're taking, you know, almost 40 kilograms of pressure off. And if you can get a standing desk or have the ability to it, you want to do that throughout the day, okay, so that you can change those numbers. And that's going to help your back feel a lot better. All right, so those are my two tips for today to help you start feeling better. So let's talk about fixing your spine. If you're dealing with sciatic pain, if you're dealing with numbness, tingling, going down your arms, hands, loss of strength in your arms or hands, or into your legs. You feel like you're tripping over your toes. Um, you just don't feel strong. Your balance isn't good. How do you fix that? Well, yes, you can go get surgery, but there's a thing called failed back surgery syndrome, and that's a real condition. It's a real diagnosis, and you don't want to be in that boat. So I always recommend that people always try a natural way of healing your body first before you start going into more invasive things. You can always go get invasive stuff done, but a lot of times once you get it done, you can't reverse it. And so you're stuck with it, and you got to live with that. So spinal decompression is the #1 tool for reversing degenerative disc disease in the facets or into the disc. And very simply, you can see right here, you take diseased tissues, diseased discs, nerves that are irritated, and you do the opposite of that. You put it on a very gentle table where you can always take a nap doing this, unload the compression like we talked about, and start getting blood and oxygen and nutrition back into your disc. And yes, you can do this from home. In my office, these were the tables when I practiced full time that I use, but you don't need to do that. The home-based units work just as good, but you got to know what to do with them, okay? So what is the benefit of this? Well, if you got a bulging or herniated disc, you have that jelly sticking out, we want to suck that jelly back in. And you can do that with this table. And then we want to make sure it's back in and then eventually get it to heal those outer rings. And the cool part is that if you look at the Dennis McClure study, every one of his candidates that he was going to do surgery on who did decompression, 100% of them had healing to the outer rings. I've seen that in my practice a tremendous amount as well, which is incredible because it's not easy to do with any sort of surgery. You can use disc seal, but I don't know how long that stuff's going to last for. And again, it's very invasive, so you can do this naturally at home. So here's a really awesome study. This is orthopedic technology. On December 2003, this was 219 patients that were all going to go have back surgery. They decided to do spinal decompression on them, and here's the results. They had 86% improvement in their ability to move. They also had 86% immediate resolution of symptoms. That's incredible. 92% physical exam findings improvements, more strength in their legs or their arms, less numbness and tingling in their arms, hands, or fingers or legs, more normal reflexes, motor strength, the ability to feel properly. We can feel your feet or feel your hands so you don't feel like you're going to drop stuff all the time. And the cool part is that 84% of them remain pain-free up to 90 days later without surgery. It's awesome. And you can do this from your home. Dennis McClure said when he did his study on all his patients, torn annular repair, the outer part of the disc, repairs were seen in all patients. All patients. Let me get my big face off of there so you can read that. Torn annular repair was seen in all patients, and also rehydration of the disc was detected in almost everybody as well. I have seen that many, many times. So let's look at a couple cool pre and post MRIs. These are patients of mine. I always talk about, hey, you can talk about this stuff all day long, right? And tell stories, and which is great. Testimonies are amazing, but if you want to up your game and you want to talk real science, let's look at pre and post imaging of people. So let me show you some pre and post MRIs of 12 weeks, like I talked about. It's a 12-week program, all right? So let's look at this. Here you can see a gentleman, severe low back pain, diminished reflexes, big, massive herniation right there. I won't get too technical with this, okay? 12 weeks later, gone. No sciatica, normal reflexes, no back pain anymore, or minimal back pain, was able to go back to his work and do his duties again. Here's another person, massive disc herniation right here. Stephanie, you should probably be an expert at this by now. Big, massive herniation right there, okay? 12 weeks later, almost totally gone. No surgery, people, no surgery. It's severe low back pain, muscle weakness, couldn't even stand properly and walk properly. After decompression, no low back pain. Disc rehydration, I can show you that. We can do another live sometime. I can show you what that looks like because that can be a little bit long. You can just trust me on that. No sciatic pain, normal bowel movement function again, which he didn't have before, and was able to be an active dad and run his businesses. Here again, it's a guy, just talked to him the other day, and massive herniation right here. Again, massive herniation right there as well. Same disc, L5, 4 surgeons told him he needed back surgery. It was the only way he was going to fix it. Not for this guy. 12 weeks going through my program. Right here, almost 0 herniation left. You can see this massive reabsorption of this disc material. Still had some work to do. So he'd come in and do decompression once a month after that. No back pain. He's been hiking, getting ready to be a dad. Super cool, super excited for him. You know, here's another one. So I have lots of pre and post success stories for you. So let's talk about finances here a little bit, because when it comes to doing spine work, there are finances involved. And so let's look at surgeries here. If you go and get a spinal fusion, or you're having some sort of hardware into your spine, you're looking at approximately $138,000. I'm going to let you know that was a couple years ago. That number right now is probably closer to 300. I'm seeing more invasive surgeries than I've ever seen before, so you better have a big bank account. And you know, the worst part about it is that, you know, you're already stressed about trying to get healed. Is your back going to feel better? Is your neck going to feel better? Are your symptoms going to go away? And now you got to figure out, how are you paying 10% of that? Because that's a big number, right? At a minimum, and that's if you have, you know, a small deductible. You might have a $10,000 deductible, and you still have a 10 or 15% coinsurance on that. So you're talking $20,000, $50,000 you got to come out of your pocket in hopes that you're always going to feel good. And we know that failed back surgery syndrome is a real thing, and most people within 3 years wind up getting surgery. We also know if you get an epidural, because we just read this 2 weeks ago, within 12 months you have a 70% chance of getting back surgery. So you got to realize, if your doctor's telling you to go get an epidural, you have to be thinking ahead. Wait a minute, if I do this, if I don't figure out a way of naturally fixing my spine through the procedures that we teach about here in Disc University, 70% of you are going to wind up getting back surgery. That's a real number. And that number is way too high, and I don't want that happening to you, okay? So let me show you other ways to do it. And if you go onto here, even if you had a laminectomy, again, that's a major surgery. You're cutting out a part of your bone in your spine to relieve pressure on nerves instead of decompressing it. You're still at $52,000, okay? Big numbers. So can you do this a different way? Well, you can do this a different way. That's the whole reason I created Disc University. I created a Disc University course for people that are suffering with low back issues, and I also created a separate one for people that are dealing with neck-based related pain and problems. So what do you get to learn Disc University? Well, you get to learn some amazing stuff. I mean, this is 24 years experience from one of the top people in the entire United States teaching you how to do this from your home. So when you get into the course, you can take this at your own pace. You can watch the videos as many times as you want, and you get the piece of equipment to do it, and you get to keep it. It's yours. So, you know, we share some success stories with you. I show you how to make sure that you do the right things and avoid the wrong things when you're going through this 12-week process. It's imperative to know that, and to make sure that you have the support from your family. So I always tell people, watch this video with your spouse or significant other if you have someone, because you want the support of them to understand what I'm recommending, just to maximize and speed up your healing the most, okay? It's the whole purpose behind that. We teach you how to do spinal decompression at home when we send you the piece of equipment step by step. Super easy to do, but you got to know how to do it properly. How to track your progress. When to use ice versus heat if your back's bothering you at times, and it's going to over 12 weeks. It's not going to be cured in one time, okay? How to get out of bed properly so that you continue to help your spine heal. How much water should you be drinking based off of your height and weight? I teach you all that stuff to help your disc heal as fast, as quickly as possible so you can feel better. I teach you how to feed your disc. What does your disc need to repair themselves? Well, it's important to know that, right? They're living tissues. I teach you exactly everything you need to know about that. We've already talked about intradiscal pressures. I teach you how to stretch your neck properly so that you feel good when you're going through this process. I teach you how to stretch your low back. I'll show you the best stretches for your low back that I've ever learned over 24 years. We talk about inversion tables. Are they any good? Well, that's a good question. You really want to know, because if you got one, should you be using it or not? Well, I'm going to teach you exactly what you need to know about it. We talk about failed back surgery syndromes. It's a real thing. It is an ICD-10 diagnosis code right now. It happens. And the problem is that your surgeon is not going to come home and take care of you for the rest of your life. You're going to be on your own. I don't want that happening to you, okay? I teach you how to read your MRI. If you have an MRI on a disc, I teach you how to read that so that you feel confident, and I explain it to you in English. I teach you how to feel after your first visit, your first week, your second week, your fourth week, 8th week, 12th week. So you know exactly what I'd be telling you in my office, so you know that, hey, I'm right where I'm supposed to be. Um, when you're ready, we start teaching your core level exercises for your low back. It starts to strengthen your back, but you can't start doing that stuff right away. So we teach you core level 1, core level 2, and core level 3. And just for smiles, all the mess ups that I did making this course that you normally don't get to see, we made a little fun little blooper video for you that you get to watch with my boys who were helping me all through this process as well. So I hope that brings some joy and laughter to your life, because laughter is a great medicine, right? I created this course just so you know, if I could share with you everything that I've learned over 24 years, what would be the benefits for you? How could you benefit from that? Well, here's some of the benefits. You can have immediate pain relief from your home. No copays, no driving to anybody's offices, no setting up appointments, no getting rides, no having to get in and out of a car when you're in pain. Do it all from the comfort of your home. Okay? You could avoid surgeries in almost all cases unless they're emergency situations, and there's not a lot of those. You could start healing your spine instead of patching it up. You could avoid painful and dangerous surgeries that most people do not need. And I'm telling you that, and I work in 2 surgical centers that I volunteer in, and I get to see a lot of surgeries that should not be being done. But they're big money, and doctors, unfortunately, sometimes want big paychecks. So you got to be a really smart consumer, and that's why I take the time to do this every week. Okay, and start getting you back to doing the things that you love to do. So that's why I created Disc University, so you can do it at home and save so much money and not having to pay for big doctor's offices and all their staff. That's why I push that savings onto you at the cost of it. What if you didn't know what I share with you on Disc University? Well, you're probably going to have unnecessary surgeries that you probably don't want to have. Debilitating pain, the anxiety of your future. What's your future going to look like if you don't get this to be healthier? You can get stuck on opioid medications, which is a whole new animal to deal with. The addiction of that. You could wind up spending time in hospitals that you don't want to do. I want to help you avoid all of that, because those are real things if you talk to people that have had back surgery. So that's why I want to share my course with you and help you avoid all that stuff so you can get back and start feeling great again. So the normal cost of mine, the whole program for 12 weeks is $997. It's less than $1,000. It's probably a tenth of what your co-insurance would be, and you're actually getting your spine to be healthy again. So if you look right here, it says coupon code. I'm going to explain that to you in a second. Just for being with me today, I've created 10 coupon codes for people for joining us. If this is something that you think would really help you, and I know that it would, I hope that you go take a look at Disc University. There's links in my bio on YouTube, Facebook, and Instagram where you can go directly and you can see the course. But if you want to do it, if you type in this code, RELIEF20, I've only created 10 of those, that'll give you 10% off. Or I'm sorry, 20% off. So that's a lot. It's over $200. They'll take off, so you're down to like $797 for that course. And don't forget, that includes a piece of equipment that you need to do it, either for your neck or low back. So once you choose those, we know what you did, and we get it sent to you as soon as we have your address, and you can start feeling better immediately. So I hope that you'll go take a look at Disc University. I worked really hard. I took all my years of knowledge and experience, plus me messing my back up like I showed you, and how I healed it from home as well. And I did it with the exact same things that I show you on that course, so you can get your life back. So Stephanie, if you got any questions for me? If anybody has any questions for me, I'd be happy to answer them before I say goodbye. If you don't, Stephanie, thanks so much. I hope you have a great day too. I can't wait to get up to Pennsylvania. I'm definitely coming to see you when I go back up there. I hope you go take a look at it. I know it's going to change your life. Please stop having to suffer with your back pain. You don't need to. I promise you, you don't need to. If you follow my course, you can have an 88 to 91% success rate from your home. And we're going to keep you that way too. So I love and appreciate you. If you got questions for me, you don't ask, direct message me, write me a comment. Be happy to answer those for you as well. All right. Till next week. Appreciate y'all. Thank you so much. Stephanie, always great having you here. Yes. It will be awesome. Get to give you a hug in person. So thanks for all your support, me, Stephanie. It means a lot to me. All right. Um, oh, hey, Marisa. Nice joining us. Happy Wednesday to you too. Um, love you guys. All right. See you next Wednesday, everybody. Have an amazing day.